Hi friends, welcome to Nurses Online Education.
Guys, let's get started. Please make sure that you are listening to all questions and answers carefully. First question for today is: immediately after a percutaneous liver biopsy, the nurse should place the client in which of the following positions? Guys, please listen, I will repeat again. Immediately after a percutaneous liver biopsy, the nurse should place the client in which of the following positions? And the options are: A. Left-sided line, B. Right-sided line, C. Lithotomy, D. Trendelenburg. Now think, which portion should a nurse place the patient in such a situation? 1, 2, 3. Now I will tell you the answer. Correct answer is option B, right-sided line. Our next question is: an adult has low back pain. Which position is likely to be most comfortable for the client? And the options are: A. Prone, B. Supine, C. Side-lying with knees flexed, D. Semi-sitting with legs extended. Guys, think hardly, you will get the answer before I say it. In which position an adult with low back pain is comfortable with? And the right answer is option C, side-lying with knees flexed. Guys, please listen, here is our third question. When planning the client's post-operative care, which is the least desirable position in which the nurse can place the client? And the options are: A. Lying prone, B. Lying supine, C. Sitting in a chair, D. Standing to shower. I think you guys already know the answer. Yes, that is it. Option C, sitting in a chair, is the least desirable position for a client while in a postoperative care. We are moving to our next question. Which of the following is the appropriate position for a patient who is suffering from acute asthma attacks? I repeat, which of the following is the appropriate position for a patient who is suffering from acute asthma attacks? And the options are: A. Right lateral, B. Supine, C. High Fowler, D. Prone. Okay, let me think. What do you think the right position would be? Hey guys, I got the answer, do you? No problem, I will explain it to you. Appropriate position for a patient who is suffering from acute asthma attack is option C, High Fowler. Guys, please listen to our next question carefully. Here you go. A patient with cough is admitted to the hospital. How can the nurse best position the patient to improve gas exchange? I repeat, a patient with cough is admitted to the hospital. How can the nurse best position the patient to improve gas exchange? Guys, think for it. Which would be best position should a nurse place the patient under this stage? I think you will find out the right position after seeing the options. A. Sitting up at the bedside in a chair and leaning slightly forward. B. Resting in bed with the head elevated to 45 to 60 degrees. C. In the Trendelenburg's position with several pillows behind the head. D. Resting in bed in a high Fowler's position with the knees flexed. I'm going to say the answer quickly. And it is option A, sitting up at the bedside in a chair and leaning slightly forward. Our next question is: following a tympanoplasty, the nurse should maintain the client in which position? A. Semi-Fowler's with the operative ear facing down. B. Low Trendelenburg's with the head in neutral position. C. Flat with the head turned to the side with the operative ear facing up. D. Supine with a small neck roll to allow for drainage. I repeat. Following a tympanoplasty, the nurse should maintain the client in which position? A. Semi-Fowler's with the operative ear facing down. B. Low Trendelenburg's with the head in neutral position. C. Flat with the head turned to the side with the operative ear facing up. D. Supine with a small neck roll to allow for drainage. Now the correct answer is option C. Flat with the head turned to the side with the operative ear facing up. Now we are moving to a set of questions very quickly. Please listen carefully and eject yourself. Are you guys ready? Then let's go. Our next question is, which of the following is the proper position for a patient undergoing a cardiac surgery? I repeat, which of the following is the proper position for a patient undergoing a cardiac surgery? And the options are A. Supine, B. Prone, C. Lateral, D. Fowler's. And the correct answer is option A. Supine. Moving to the next question. A nurse is caring for a toddler after surgical repair of a cleft palate. The nurse should position the child. And the options are A. On his back, B. On his stomach, C. On his back with his head slightly elevated, D. For comfort. And the correct answer is option B. On his stomach. Moving to our next question. The nurse observes that the infant's anterior fontanelle is bulging after placement of a ventriculoperitoneal shunt. The nurse positions this infant. I repeat, the nurse observes that the infant's anterior fontanelle is bulging after placement of a ventriculoperitoneal shunt. The nurse positions this infant. And the options are A. Prone, with the head of the bed elevated, B. Supine, with the head flat, C. Sideline on the operative side, D. In a semi-Fowler's position. What do you think the right portion would be? I will help you out. And the right answer is option D. In a semi-Fowler's position. Guys, please listen to our next question. A nurse is providing care for a client following surgery to remove a cataract from the right eye. In which position should the nurse place the client? And the options are A. Right side line, B. Prone, C. Supine, D. Trendelenburg's. And the right answer is option C. Supine.
Here is our next question. An adult is admitted for a neurological workup and is scheduled for a spinal tap. When preparing the client for the procedure, the nurse should position the client in which position? And the options are A. Prone, B. On the side with knees drawn up to chest, C. Lithotomy, D. Semi-sitting. Hey, what do you think the right position would? And the right answer is option B. On the side with knees drawn up to chest. We are moving to our next question. When suctioning the oropharynx, which of the following is the proper position of the patient? I repeat. When suctioning the oropharynx, which of the following is the proper position of the patient? A. Prone, B. Supine, C. Semi-Fowler's, D. Trendelenburg's. And the correct answer is option C. Semi-Fowler's. Guys, I hope all are getting all the questions and answers we are discussing. Great! Now our next question is: to prevent headache after spinal anesthesia, the patient should be positioned. I repeat, to prevent headache after spinal anesthesia, the patient should be positioned. A. Semi-Fowler's, B. Flat on bed for 6 to 8 hours, C. Prone position, D. Modified Trendelenburg. And the right answer is option B. Flat on bed for 6 to 8 hours. Okay guys, let's look into our next question. If a patient develops autonomic hyperreflexia, the first action his caring nurse should take is to A. Elevate head of bed 90 degree, move from supine to sitting. B. Make the bed in flat position. C. Apply ice on the axillary and groin. D. Put the patient in Trendelenburg position. And the correct answer for this question is A. Elevate head of bed 90 degree, move from supine to sitting. Listen to the next question carefully. To protect susceptible patients in the hospital from aspiration pneumonia, the nurse will plan to. I repeat, to protect susceptible patients in the hospital from aspiration pneumonia, the nurse will plan to. I turn and reposition immobile patients at least every 2 hours. B. Position patients with altered consciousness in lateral positions. C. Monitor frequently for respiratory symptoms in patients who are immunosuppressed. D. Provide for continuous subglottic aspiration in patients receiving enteral feedings. Guys, what do you think it would be? Any idea? No worries, I'll tell you. Here as you go. Correct answer is option B, to protect susceptible patients in the hospital from aspiration pneumonia. The nurse will plan to position patients with altered consciousness in lateral positions.
We are quickly moving to our next set of questions. Here you go. Which nursing action is essential when providing continuous enteral feeding? I repeat, which nursing action is essential when providing continuous enteral feeding? And the options are: A. Elevating the head of the bed. B. Positioning the patient on the left side. C. Warming the formula before administrating it. D. Hanging a full day's worth formula at one time. And the correct answer is option A. Elevating the head of the bed. Our next question. Which of the following positions is appropriate for the patient who has hypovolemic shock? And the options are: A. Prone. B. Supine. C. Semi-fowlers. D. Flat with elevating the feet. And the correct answer is option D. Flat with elevating the feet. Okay, listen to our very next question. When caring for a patient admitted post-stroke, CVA, who has altered consciousness, the nurse should place the patient in which position? I repeat, when caring for a patient admitted post-stroke, CVA, who has altered consciousness, the nurse should place the patient in which position? A. Sideline. B. Prone. C. Supine. D. Semi-fowlers. Now what do you think the correct answer is? Yes, you are right. It is option A. Sideline. Moving to our next question. A nurse is providing instructions to a client and a family regarding home care after right eye cataract removal. Which statement by the client would indicate an understanding of the instructions? A. I should not sleep on my left side. B. I should not sleep on my right side. C. I should not sleep with my head elevated. D. I should not wear my glasses at any time. And the correct answer is option B. I should not sleep on my right side. Guys, I hope all of you are educating yourself while listening to this session. Now let's see our next question. The day after an amputation, the client begins to hemorrhage from his stomach. What action should the nurse take first? A. Apply a pressure dressing to the stomach. B. Place a tourniquet above the stomach. C. Notify the physician. D. Apply an ice pack to the stomach. And the correct answer is B. Place a tourniquet above the stomach. Guys, now we are moving to our final question for this session. Listen carefully. A 72-year-old male client has a total hip replacement for long-standing degenerative bone disease of the hip. When assessing this client postoperatively, the nurse considers that the most common complication of hip surgery is: I repeat, a 72-year-old male client has a total hip replacement for long-standing degenerative bone disease of the hip. When assessing this client postoperatively, the nurse considers that the most common complication of hip surgery is: A. Pneumonia. B. Wound infection. C. Hemorrhage. D. Pulmonary embolism. And the correct answer is option D. Pulmonary embolism. Okay, that's all for now. Hope you all had a great learning experience. We'll come back with more question answer in the future.